Shocker Medical College and Hospital, Kolkata.
Hello, my name is Atik Ahmed. Currently, I am working as an intern in Medical College, Kolkata.
Hello everyone, I am Ayush Kumar, currently in MBBS final year at KIMS Bhubaneswar. Together we are representing Team A as East Zone in the NAMS National Grey Matter Quiz Season 14 Grand Finale. Thank you.
Good morning, this is Yash Tatwani, currently an intern from BJMC College.
Myself Om Shah from BJ Medical College Ahmedabad from intern batch.
Myself Nishit Thakkar, 2019 batch, BJ Medical College Ahmedabad, and we are representing Team B West Zone.
Hello everyone, myself Pranay Sinha. I'm an intern at XIV Medical College and KM Hospital, part of the Team C Central Zone as finalist for season 14 of Grey Matter, and I'm very excited to be a part of this quiz and really looking forward for it. This is Diladhar Nabar, intern XIV Medical College, representing the Central Zone in the esteemed DAMS Grey Matter quiz. Excited to be here and looking forward to the competition.
I am Chaitvi Bhanushali. I'm a final year student at XIV Medical College. I'm representing Central Zone in the season 14 of DAMS Grey Matter quiz. I'm very excited to be here and I'm excited to learn a lot of new things.
Hello everyone, my name is Riya Gupta. I am from 21 batch EBBMS RML.
Hello everyone, my name is Arya Ganesh Oja and I am from ABBMS Dr. RMS 21 batch.
Good morning everyone, I am Taruni Mukherjee from ABBMS and RML 2021 batch, and we are representing Team D at the Grey Matter finals. We are really excited for the finals.
Hello, we are students from Maulana Azad Medical College and we are representing Team E North Zone 2.
And I am Dr. Mihir Rai from 19 batch from Maulana Azad Medical College.
I am Tejas Sekhri from 2020 batch.
And I am Utsav Batra from 2020 batch. Thank you.
I'm Dr. Rajesh Raj, post-intern from Government Medical College, Thiruvananthapuram, here representing South Zone in the DAMS Grey Matter Season 14.
Hi everyone, my name is Mananjan, third year MBBS student studying at Siddhartha Medical College, Vijayawada, Andhra Pradesh, and we are here to represent South Zone and exciting for Grey Matter quiz.
Good morning to everyone, and this is Prabhakar from Madras Medical College, final year MBBS student. I'm very excited to participate in the Grey Matter Season 14 final. Looking forward.
Hi everyone, very good morning to all the brainiacs here, the super bright minds from all across the country for the much awaited grand finale of the Grey Matter quiz. Now this quiz has a legacy. By reaching this far, you've already proven that you're the best minds in the country, and now the sky is the limit for you. So a very warm welcome to all our participants from the entire DAMS family. So as you know, the grand finale is a quiz which is much awaited, held annually, and the winners have some great prizes. They also carry the legacy of being the top rank holders in almost all exams henceforth. Yes. So from the depth of wisdom emerges the battle of the minds. Diagnose, decode, and dominate. Let the sharpest mind and fastest finger win the quiz. Welcome to the extraordinary feast of wisdom and knowledge, the grand finale for the Grey Matter quiz. So now, while the screen is turned on, we have 6 teams for the finals from Team A to Team F. I will quickly introduce our esteemed teams. So Team A, East Zone, a very warm welcome to Dr. Ayush Kumar from KIMS Bhubaneswar, Dr. Atik Ahmed, Medical College, Kolkata, Dr. Rohit Das, Neel Ritan Sirkar, Medical College, Kolkata. Welcome, Team A. Team B, our West Zone team, we have Dr. Om Shah, Dr. Nishit Thakkar and Dr. Yash Ratwani, BJ Medical College, Ahmedabad, Gujarat. Welcome Team B and all the best. Team C, the Central Zone, we have Leeladhar Nabar, Dr. Chaitvi Bhanushali and Dr. Pranay Sinha from XIV Medical College and KM Hospital. Welcome to the grand finale of Grey Matter quiz. Team D, North Zone, we have Dr. Arya Ganesh, Dr. Tarunim Mukherjee and Dr. Riya Gupta from RML, New Delhi. Congratulations, Team D. Team E, North Zone 2, we have 2 teams from the North Zone. So Dr. Tejas Sekhri, Dr. Utsav Batra and Dr. Mihir Rai from MAMC, Delhi. A warm welcome to both the teams from the North Zone, and then we have our team from the South Zone. We have Dr. Manan Jain from Government Siddharth Medical College, Dr. Prabhakar from Madras Medical College, and Dr. Ajish Raj S. from Government Medical College, Srivantapuram. So happy to have all of you here, and once again a very warm welcome. So I'm going to quickly give you a synopsis for the rounds. So we have 6 rounds. The first round is going to be the trivia round. The second one is going to be connections. Third is a case-based round. Fourth is the buzzer. Fifth will be a round on recent advances. And finally, the cherry on the cake is the rapid fire where the tables can turn. So yes, myself, Dr. Deepthi Behil and Dr. Sumer Sethi, we are going to be your quiz masters, and we are deeply honored to be among the top brains of the country. So all the best, everyone, and may the best team win.
So as you already know that the decision of the quiz master will always be final. So I'm sure there will be no arguments, and we already know that whatever we will tell will be considered as the final answer. The round 1 will be trivia. We will start from the questions related to trivia and medicine. Total of 12 questions will be there. We'll go from A to F, then we'll go from F to A. Correct response will have +10. A written pass will have +5. That means if you don't answer, it will pass to all the teams, and then we will calculate the marks accordingly. There will be no negative marking. Time limit will be 30 seconds. Quiz master's decision will be final. So we'll pass to all the teams, +5, no negative marking. So we'll start from team A. If you answer correct, then it will not be passed. And so even if they don't answer or they get it wrong, then it gets passed. Yeah, then it gets passed to other team. Otherwise, will not. If you get it right, then there's no point in checking the other rounds. Okay. Ready? Team A from East Zone. Ayush, Atik, and Rohit. Are you ready? Yes. Okay. So let me show you the question first. Let me get the question. Connect and identify. Connect and identify. You feel free to get up also if you want to see the screen sometime and it is difficult to see, you can do that also. Connect and identify. If anybody is having tough time to see also, you can just get up and see also, no problems. There is a person, and then there are some things related to those names in the images shown to you. The time is up. Time is up. So it passes to other teams. Anybody wants to submit the pass? So okay. So can you just write it in a piece of paper and submit? Have you written something? Give me just 1 second. So we are not taking it. And anybody wants to pass it on now? Anybody else? You want to submit your answer? Yes. So we have the answers from team D is saying miratinib. That is not the answer that we have with us. Team F is saying Jonas kinase receptor. No. Team D is saying Burkitt. No. And team D is saying Corgen Carr Branson. Okay, that is again not the correct answer. Okay, so so it's matching a little. That's why I was getting confused. So the name of the person that you see on the screen is Ogden Carr Bruton, and the logic was we can see the BTK written somewhere. So it was Bruton tyrosine kinase X-linked agammaglobulinemia, and BTK inhibitors are after his name. It says used in CLL, mantle cell lymphoma, and multiple sclerosis. So that was the answer. I think nobody gets any answer. So I'll again go to the next question for team B. So team B from the West Zone, from BJMC Ahmedabad, you have a direct question for you. I will show you the image and you will have to give me the answer. Okay, ready? Okay. Identify this man with golden arm who died in February 2025 and what was his contribution? Yes.
This guy's Harrison and सबसे ज़्यादा donate किए थे इसने blood donation सबसे ज़्यादा maximum.
So I think we can give it to them and full 10 marks. Great answer. So this guy is James Christopher Harrison. He is an Australian blood donor for antibodies against RHD antigen useful in RSD disease. Donated 1173 times. Saved lives of 2.2 million babies. Massive. Big hand.
Great. So
Great answer actually.
gets full marks. Well done. That's a good start.
So team B gets plus 10 marks. Okay. So
we
then
have our scorekeepers and the timekeepers.
yes. You also keep your own scores also just in case there is any controversy. We can see that in the end. So team C from the central zone from SET GS Mumbai. Are you ready? Are you able to see the screen? You want to come closer? Okay. I'll show you the question and then we'll see your answer. One of the most highly cited papers were co-authored by these two. What is their contribution to field of medicine? Yes. Please come closer. So we are giving you 5 seconds extra also to come closer. Okay. Yes, please. Yeah. Please answer. So I thank you very much, and I think they're absolutely right. These are Edward Kaplan and Paul Mayer. Kaplan-Mayer survival curve was given by them. Both of them submitted similar articles individually to Journal of American Statistical Association. So great answer, Team C. Team C gets plus 10 marks. So now we'll go to Team D. Okay. And I will show you a question. And are you ready, Team D? Let me just show you the question now without revealing the answer. I have to be very careful. Yes. Identify the scientist and their contribution. Famous classification was given by them. Name the scientist. One of them is an Indian. And their contribution, they've given a famous classification that you all know of. There's a clue in the image itself. Team D. Classification for? Heart failure. So that is not correct. It passes on to other teams. The answer should be complete, then only we will give you the full answer, full marks, but we can be a little soft if it is closer. So the time to submit your pass is now over. Please give it finally, and Kanika, please bring the sheets back. So the team B has given an answer of, okay. So team B is close. I think we can give it to them. Team B is correct. Team C is also correct. Okay. Anybody else? Okay, so B and C have given the correct answer. The scientists that you see in front of you are, I think, similar only.
C has
same.
The names as well. Yeah.
Okay. Yeah. I think B and C are correct. I think. So yes. So the name of the scientists are Vaughan, William, and Brahma Singh, and they are the people who gave the anti-arrhythmic drug classification. Team B and C. So the scorers, team B and C get +5. B and C they get +5. Now is the question for Team E. Team E, are you ready? Okay. So I will give you a picture and I will ask you the question regarding the question. Okay. Identify the celebrity and the disease she is suffering from. The clue is in second picture. Team E. Identify the celebrity and the disease that she is suffering from. Team E. Everybody else can start writing with their, write your team name and your answers in the sheet if you want. If they don't answer, it will get passed. Team E. Yes, Team E. Any answer? Many of the teams are very confident that they will get a pass. Time is up better. Team E. Any answer?
Down syndrome.
Down syndrome is incorrect. So any other team wants to pass? Yes. So please collect the sheets from the past teams. So this, you have to name the person and the disease she is suffering from. Team C, the answer is not correct. Team B, it is not correct. A is not correct. And I think D is also not correct. Okay. So none of the teams get it right. The celebrity is Charlotte Figi, the American girl with Dravet syndrome who took cannabidol to prevent seizures. Charlotte Webb, low-dose cannabis and drug cannabidol is inspired from her. April 2020, she died due to cardiac arrest, proclaimed as Charlotte Figi Day in Colorado. Okay, so the final question from this, this circle will go to Team F now. Team F, are you able to see me? Team F? Yes? Okay. So what I'll do is I'll show you a question and there is something to be answered and it's a very good question actually. So Team F, are you ready? Yes? Perfect. These two famous inevitable surgeons died of colonic cancer and gastric cancer, with former being affected by mania. Identify both of them. It's a very important thing to know actually about life. These two inevitable surgeons died of colonic cancer, gastric cancer, with former being also affected by mania. And the time is Time is almost up. Okay. So Team F, the time is up. Anything you want to say or we pass? What is the name? Dukes and Bilroth is not correct. Okay. All other teams, anybody wants to pass in next 10 seconds? So the Team E, which team is this?
Team A.
Team A, please write your Team A. Team C, E, D, B. Okay. So the only two teams who have got it correct are Team C and Team E. Team C and E have got it correct. Any guesses? These are the famous Bailey and Love. So I told you it's a good question. It is about the book that you all read, the people that you have known. They are already there in your practice of surgery book. Bailey and Love was the answer to the question. So Team C and E got it correct. So Team C and E get +5. First cycle is now done. So we'll do one more cycle. This cycle will go from F to A. And now after this round, then we'll do the scores. Okay. So we'll see the scores after this round to be on the safe side. Okay. So Team F, are you ready? Okay. Team F, let me show you a question now. Identify the significance of this stamp. Team F. Identify the significance of this stamp. I hope you are happy with the questions that have been taken. And the time is almost up. Team F, you want to give an answer?
Rabies, man.
Team F are saying rabies. I think there's very obvious, but that is not the answer. So other teams can give the answer now. Okay, so Team A, B, and E have given the answer. And I think we can give it to Team A, B, and E have got it correct. This is the stamp about diphtheria, where there was an outbreak of diphtheria in Alaska, which led to famous Nana to Gnome dog-led run of antitoxin to treat these sick children. And we like to appreciate that Team E has given the correct name also. Team E is the one which is given the full name. Others have given description of what has happened. So I'm giving it to all three, A, B, and E +5. A, B, and E +5. Very good. So the next question is now for Team E. Team E.
Are you ready?
Yes, direct question for you. I'll give you the question which is direct and easy, and I'm sure you will jump on it. Identify the scientist and his contribution. Identify the scientist and his contribution. It's actually very easy. Team E. Team E, what is your answer? He's saying Whipple, and I'm absolutely right. They get +10. Ellen Whipple, pancreatic duodenectomy procedure for periampullary cancer. Whipple's triad for insulinoma was also given by him. Okay. So next question for Team D now. Team D. Okay. You have to now look at the scientist. I'm going to show 1, 2, 3. Yes. Identify the scientist and his contribution. Team D. Team D. I am sure you know it. Okay. The time is.
Scientist is Downey. He gave the Downey score.
What are you saying, Team D? Downey score is not correct. So we are passing on to other teams. So we have some answer by A. Yes. Let us see the other teams. Snatch their papers. Many of them are writing like they're writing in a college exam and not writing full essays. Team E and A. A and E are getting it right. The scientist that you see in front of you is Virginia Apgar, American physician for Apgar scoring, done at 1 minute and 5 minutes. And I think one more bacha F has given the answer, but is not correct. But A and E +5. A and E +5. And I would also like to tell you that it is a new pattern that in the last 3-4 years in every INICET paper, every alternate INICET paper, they ask a trivia, usually related to recent Nobel Prize or recent discovery. It is not a bad idea to look at trivia for your exams as well. So next question is for Team C. Are you ready, Team C? Okay. 1, 2, 3. Identify this Nobel laureate and mention their contribution. Identify the Nobel laureate and mention their contribution. Team C. And the time is almost gone. Yes. So no answer. Okay. Anybody else wants to give an answer? Okay. Okay, so the time is up to submit any answers. Anybody has answers? No. Dr. Deepti? Okay. Okay, so I think we will not give to anyone. The correct answer is, okay, so the correct answer is Andrew Fire and Craig Mello for their discovery of RNA interference gene silencing by double-stranded RNA. They got the Nobel Prize for Medicine in 2006. Okay, so now we have a direct question for Team B. Team B, are you ready? Team B from West Zone. Yes, ready? Okay. Connect and identify the common disease. We need the disease. Connect and identify the common disease. It's a very easy question actually. Yes, Team B. What do you think is the answer?
Rabies.
Team B says rabies, which is incorrect. I would like to pass it to other teams. Just write your team name and the answer so that we can see if anybody has answered it correct. Just one more question left in this round. Okay, so anybody wants to give any answers? No. Team F, again, no. Okay. Team C, D and E have got it correct. They get 5 marks. C, D, E have get 5 marks. Anybody know what is the answer? Syphilis. Syphilis. This was Paul Ehrlich, and the image was the magic bullet. We discovered the drug, and the NIST discovers who himself suffered from neurosyphilis. So that was the answer, and the question was syphilis. So the final question of this round goes to Team A now. Team A, are you ready? Okay. Very interesting question. It will take some time to look at it. So let me just, Team A, are you ready? Okay. We'll give you 35 seconds. Don't worry. It's a long question. One of the paintings of Francisco Goya painting is now considered to represent an episode in which a blind man opens the mouth of a young Lazaro to smell and detect if he has eaten a stolen sausage. Before this, however, the painting was named and still popularly known as El Garrotillo, referring to something a man believed to doing to elevate a certain illness in the boy. What was he believed to be doing? Yes, Team A. They say that he was removing the diphtheria membrane, and I say they're absolutely correct. Full 10 marks. He is removing the pseudomembrane of diphtheria. Well done. Full 10 marks for all of you. Yes. So full first round is now over, and we have seen now we've done 2 rounds for this trivia. I'll ask if the team is ready with the score so that you can cross-check your.
Okay, meanwhile, while they are preparing the scores, did you enjoy round 1, Team A? How did it go?
Definitely, ma'am. बहुत मजा आ रहा है.
Good, keep it up. Team B?
Yes,
ma'am. Yes, okay, all the best. Team C, how's it going? Absolutely. Well done. Great. Team D?
Yes, ma'am.
Okay, go for it. Go for the kill. Yes? How's it going? Good. Okay, they're saying let us win and then we'll talk. Okay, boys, how's it going? Buck up. There's more and scope for improvement. So are we ready with the scores?
So at the end of round 1, which is the trivia round, Team A is having 20 points. Give them a round of applause. Team B is again at 20 points. Team C is at 25. Give them a round of applause. Team D at 5. And Team E is leading the table with 30 points. Team E, 30. Team F is yet to open their account. So Team F is yet to, but there is a lot of rounds left. This is just the beginning of the quiz. Okay. So I hope you are all okay with the score so far. So we will not look at the score of this round again. We will not entertain any more queries about this round later on. So the scores are now logged. Okay. So let me introduce the next round to you. The next round will be called as the connections. Okay. In this round again, there will be total 12 questions. Each team will get 2 questions, one in the clockwise manner, one in the anti-clockwise manner, just like this. Correct response 10 marks. This time we will not pass, no negative marks. 45 seconds. Decision will be final. Are you clear? So in each question, we will tell you, what is to be done, but usually it will be the final connect which will be good enough. Okay. So are you ready now? So we'll start from Team A. Are you ready, Team A? Okay. Ready? Okay, let me get the image on the screen without revealing the answer. Yes. Connect and name the theme of the year 2023 of the disease described. 7.5 plus 2.5 marks. Clue related to current round. Yes. Connect and then name the theme of the year 2023 of the disease described. What is the disease and what is the theme? And the clue. Okay, we'll look at their answer first. Yes. Okay. So I will give it to them. We'll give it to them. Actually, I just wanted to show them the part that was hidden, but that's okay. So the disease that we are looking at is orange ribbon for multiple sclerosis. May 30th is the multiple sclerosis. Yes, they have already written it correct. So the theme was I connect, we connect. I connect, we connect. So what we are going to do is we'll give them 7.5 marks because they did not name the theme. Okay, so 7.5 marks because they got the disease right, but they did not tell. The theme is I connect, we connect. The disease is multiple sclerosis. Orange ribbon means awareness. May 30th is the day every year. And the image that we saw was Jean Martin Charcot's triad of scanning speech, intention tremors, and nystagmus. Then the lady that we saw was Sylvia Laurie, founder of First National MS Society in US. 2025 theme was My MS Diagnosis. So you did not give the theme, so we are giving you 7.5 marks out of 10. 7.5 marks for team A. Now in the next image, okay, team B, direct question for you. Ready? Connect and identify. Connect and identify. It's a very interesting question. Yes, team B. It's a very interesting question, and I think even the audience who would be watching us in the YouTube would also enjoy the question. Yes, team B. Yes. If you know chess, you will know the answer. Yes, team B.
The first image is showing castling move, castle, which is a second image is moth and alopecia, and last we are not able, but the connection would be Castleman disease.
Actually, you are just guessing it, so we should not be giving it to you, but I'll tell you the correct answer, then we'll decide together if you should be given or not. The patients who are treated with tropical immunotherapy for alopecia areata experience air regrowth at distant untreated sites. This has been called as castling phenomena in reference to the chess maneuver where the rook jumps over to the king on the other side of the board. But you got the chess move correct, but that was not the idea behind the quiz. We are at a medical quiz, not at a chess. So I don't think you should be given a score here because even the medical part was not given, so we cannot give it to you right now, so they don't get any scores now. So team C, are you ready for your direct question? In this particular connect, you will have to tell, okay, it's slightly tricky, so I'll show you the question, and you may want to get up also to come closer also, it's okay. Connect and identify all of this used for treating which condition? I think we can give it to them. Well done, full 10 marks. Good. So the connect was hyperkalemia, sodium zirconium cyclosilicate, sucroferric oxyhydride, salbutamol. They identified insulin also. I think somebody was saying. So well done, beta. Well done. Full 10 marks to team C. Well done. You got the final connect right. Okay, team D now. Team D, what I'll do is I will show you an image. You have to just connect. Team D, are you able to see me and see the image? Ready? Okay. So I would request my team members to also tell all the participants that they are under camera surveillance. Don't use any kind of unfair means. Even if I don't notice it, later on when the video will be on the YouTube, people will take a clip of that video and make you viral. Okay. Now connect. Easy question now. Team D, very easy question for you.
Connect is meant to be. Second picture is showing myelinated corneal nerve. Third is marfanoid habitus. Fourth is mucosal neuromas. First is Men in Black.
So well done. The correct answer is meant to be syndrome, red gene, chromosome 10q, myelinated corneal nerves, mucosal neuromas, and marfanoid habitus. Full 10 marks to team D. Full 10 marks. Well done. Okay. Team E now. Are you ready now, team E? Yes, team E. Are you ready? Okay. Team E. I'll show you the question. It's not a tough one, so please jump on the answer. Ready? Connect and identify the drug. Connect and identify the drug. Team E. Connect and identify the drug.
Methimazole.
Okay, I think we can give it to them. Full 10 marks. The correct answer we have is carbimazole, aplasia cutis congenita, insulin, SS, autoantibodies, Graves, Hirata syndrome. That is the clues that we had in the image. Well done. So now the next connect the dots will be for team F. Are you ready, team F? Yes. This is your chance to open your accounts as well. First time is always special. Yes, ready. Okay, connect and diagnose. It's a very interesting connect. Yes, the time is. Yes, team F.
Pittsburgh agent.
What is the answer?
Pittsburgh agent. Pittsburgh.
Pittsburgh variant is not correct. Okay. So there are no marks for now the pass, but anybody else in the teams wants to give an answer, or anybody who's watching us on YouTube wants to give an answer. Yes. Cento? It's America, I think. I don't think this is Greece. Okay. Anybody else? Okay. So the correct answer is Coxsackie B virus. The first image shows the microscopic structure. The second image shows the area Coxsackie in US. The third image is showing pleurodynia, and the next image is showing pancreatitis. So this was the correct answer, was Coxsackie B virus. So now we have done the first circle of all the 6 teams. Now we will start at team F once more. Team F, are you ready now? Team F, are you ready for the syndrome connect? Are you ready, team F? Yes? Okay. So team F, I am going to show you the image on your screen now. Connect and diagnose the syndrome. I think it's doable.
Menetrier's.
They are saying Menetrier's disease. Absolutely correct. They get full 10 marks. It is due to increased production of TGF alpha, which is shown in the first image. Cerebriform appearance of mucosa is shown. Edema is shown. Cause through appearance of gastric glands was shown in the image. So this gives us the answer. The answer is Menetrier's disease. Full 10 marks to team F now. Now we'll go to team E. Team E, again, it's a very easy question, so you have to jump to the answer now. Team E, are you ready? Yes? Okay. Connect and name the syndrome. Connect and name the syndrome. They are saying Fragile X syndrome, which is absolutely correct. You can see the large mandible, FMR gene mutation, macroorchidism, and most common cause of mental retardation. This was Fragile X syndrome. Full 10 marks to team E. Well done. Give them a big hand. Well done. Okay. Next question now for team D. Team D. Now, are you ready, team D? Okay. So it is again a easier question. So be on your toes and answer it fast. I'll show you the image and the connect. Connect and identify. Connect and identify. Yes.
This is shown, it is also called as rocket fuel.
Well done. It is aconite poisoning. The flowers are resembling the monk's hood. You can see the harsh reddish like aconite root. Blue rocket is another name for the aconite. And you could see the hippus phenomena in the eyes. Well done. Full 10 marks. Well done. Very good. So now all the teams are warming up. So I will give you a direct question now for team C. Team C, are you ready? Okay, again it is a connect and the answer is actually a acronym. Connect and identify the syndrome. Clue, it will be a acronym.
The XIV syndrome. So the first one is heartburn curl, ubiquitin, proteasome, degradation pathway for which the numerically clear. And clinical features, vacuolated microphase, perichondritis, schizophrenic traumatic, clinical features. So
Perfect. We give them full 10 marks. It is VEXA syndrome, vacuoles, E1 enzyme, X-linked autoinflammatory somatic syndrome. So autoinflammatory syndrome with lung involvement was shown in the first image. The second image shows vasculitis. Then there is neutrophil in the alveolitis, vacuoles in the myeloid precursor cells. Neutrophilic dermatosis is E. F is showing us, I think, tender plaques. G is showing auricular chondritis. H is showing nasal chondritis. The answer is VEXA syndrome. Well done. Well done. So I think they get full 10 marks. Now team C. So now the question is coming for team B. Is interesting question, and you just need to look at the image and tell me what is the connection in the images. They may not all connect into a single syndrome, but there is some connect in the images. Okay. Ready, team B? Okay. Connect and tell us what is the connecting part in all of them. There is something which is connecting all of it. What could be the connection in them? Connection.
Connection is also syndrome.
Not necessarily, not necessarily. That's why I clarified. It may not be a syndrome, but there's something which is common in all of them. Time is up now. What is the connection? Any idea? Actually, it's a naughty connection, so that's why I'm saying it may not be all connected. I don't know. Maybe you're asking or telling. I don't know. Okay, so time is up. Yeah, you try, please. Okay, unfortunately, we cannot give you the marks here, but you were close, but finally you could not find the connect. The first image shows you bat wing dystonia. Bat wing dystonia, which is seen in vitamin B12 deficiency. Second is bat wing appearance of pulmonary edema. And then there is an image which is showing us the reverse bat wing or the photographic negative pulmonary edema of chronic eosinophilic pneumonia. And the final image shows bat wing sylvian fissures which are seen in glutaric acidemia. Can you now think of the connect? Bat was the connect. Bat wing was the connect. So bat wing was the connect in the images. So final question of this round will now go to team A. Okay. You may know this. It is not a tough one. So be on your toes. Are you ready? Okay. Identify and connect. Absolutely correct. It is Ehlers-Danlos syndrome, typical facies, posterior embryotoxon, tetralogy of Fallot, bile duct paucity, and butterfly-shaped vertebra. You identify all of them correctly. You deserve a big hand and full 10 marks. Full 10 marks. So that comes to the end of the round 2. And by the end of the round 2, now we will see the scores. And I'll ask Dr. Deepti to take over for the round 3. Okay, so let me give you the scores so far. By the end of round 2, team A has 37.5 marks. Well done. Team B has 20 marks. Team C is at 45 marks. Team D is at 25 marks. Team E at 50. They're leading at 50 marks. Team F is at 10 marks. Is the score correct according to you? Okay, so we are locking it now. The scores are locked till team round 2 now. So now we'll go to the next round. The next round is going to be called as the House MD round. In this round, we will give you 12 cases. Each team again will get 2 questions, A to F, F to A. Correct answer will get plus 10. This time there will be no pass. 1 minute will be there because the questions will be a little long. We will decide case to case basis, because, yes. Okay. So what I'll do is I'll show the first question to team A. Okay. So we'll take our time to read through the question. You can also side by side read the question. Okay. Ready? Team A. A previously healthy, intelligent 17-year-old male is brought to the attention of the school guidance counselor for behavioral problems. He's getting into fights. His grades are declining. Over the next few years, he becomes involved in multiple illicit substances. After 6 years, he is brought to neurologist for cognitive problems, whom he lives with. They report his memory is quite poor and he is getting lost on the way from house to the grocery market where he works. Have you seen all the keywords? His family history is significant for an aunt who died of some sort of dementia in 30s. HIV, VDRL are non-reactive. On physical examination, he is well nourished, no dysmorphic facies. Mental status exam, poor memory registration and recall at 5 minutes. Mildly diminished vibration and proprioception at toes and ankles. +1 DTR at ankles. Rest of the neurological examination is unremarkable. NCS shows diminished conduction velocity but normal amplitude of sural nerves. MRI will be shown in the next slide. Done? Okay, sure? Okay. So now I come to the final slide of this case. MRI shows bilateral diffuse white matter hyperintensities predominantly in the frontal lobes, no contrast enhancement with sparing of the subcortical U fibers. There is what is the diagnosis? A new FDA gene therapy recently approved for the disease. Okay, it's a very interesting question. I'll just go back again and just show you the problem once more. And you also need to tell us the new FDA gene therapy which has been recently approved for this disease, which is a possible question in the next INICET as well. Okay, and we have 1 minute for them. No problems. We are not in a hurry. And the time is up. Any answer? I think we can give you half the marks. The diagnosis is correct. So diagnosis is metachromatic leukodystrophy. Why? Because you have both CNS and PNS changes. You have cognitive decline, demyelination, peripheral neuropathy. The enzyme is aryl sulfatase A. And the treatment that we were looking for was lenmeltli, etidarsan gene auto stem cell, new FDA approved autologous stem cell transplantation for MLD. So it is one of the possible questions for future exams as well. So lenmeltli. Okay. So team A, they get 5 marks. 5 marks. Okay. So these are the other kinds of leukodystrophies that we are aware of, which we have anyhow seen in the classes. You were thinking of Alexander's disease? No. But Alexander's disease subcortical U fiber will not be spared. So that was one of the clues in the question. Okay. So I will now just check the question for team B. Okay. It is a single slide, and the next slide will be the answer. So I'll show you the image question for the team B now. Team B, are you ready? And your time starts now. 3-month-old infant presents with poor weight gain, vomiting, irritability for past month. Parents report a musty odor to the urine. There is no fever or diarrhea. Child is exclusively breastfed. On examination, weight and head circumference less than 3rd percentile, abdomen distended, hepatomegaly, no splenomegaly is there, mild jaundice, no dysmorphic features, no biliary obstruction. LFT shows increased AST, increased ALT, increased bilirubin, increased PTINR, increased tyrosine, increased succinyl acetone, increased succinyl acetone in the urine organic acids. What is your diagnosis? And again, mention the new drug for this condition. We need both diagnosis and the drug. Will give half of marks each. Okay, team B. We have tried our best to keep the round challenging for you, because otherwise you are the smartest people in the country. So we have to make you suffer.
Sir, tyrosinemia type 1 and the drug is nitisinone.
They are saying it is hereditary tyrosinemia type 1, which is absolutely correct. And the drug is nitisinone, which is again correct. Full 10 marks. So musty odor was written there because of succinyl acetone, coagulopathy, increased urine succinyl acetone was the clue. Nitisinone inhibits 4-HPPD and phenylalanine free diet. Long-term treatment will be liver transplant. So they are absolutely right. They get full 10 marks. Well done. They deserve a round of applause. Okay. So now team C. I will show you slide by slide and then I'll tell you when to answer. Okay. I'm taking control of the question. Yes. Okay. So that is the answer. Okay. Ready? Team C? Okay. A 45-year-old male presented with bilateral pedal edema for 2 months. Dragging sensation in right upper quadrant. Shortness of breath with orthopnea and PND for 1 month. Bilateral pedal edema, basal crepitations, raised JVP and hepatomegaly. Lab parameters show elevated pro-BNP levels. 2D echocardiogram shows left ventricular hypertrophy, reduction in global longitudinal strain and ratio of apical long strain to average of mid and basal long strain is 1.4. Take your time in reading the page, then I'll show you the next page.
Slide for you. Okay, next slide.
Next slide. Cardiac MRI is done and shown below. What is your diagnosis? And name one drug approved for this condition. Okay, do you want to see it again? Read the first page again. First slide again. 45 male, pedal edema, dragging sensation in the upper quadrant, crepitations, raised JVP, hepatomegaly. 2D echo shows left ventricular hypertrophy with a reduction in the global longitudinal strain with ratio of apical longitudinal strain to average of mid and basal longitudinal strain is 1.4. This is the first slide. Yes. Okay, and treatment, do you want to tell the treatment? Any drug for treatment? I think we can give full 10 marks to them. Well done. It is cardiac amyloidosis. The echo shows longitudinal strain in LV is due to impairment pronounced more at the base and the mid-ventricular lesion. Cherry on the top is the sign. Longitudinal strain apex is paired compared to more involvement of the basal and the mid-ventricular regions. MRI has a classic appearance of late gadolinium enhancement, and there is early subendocardial gadolinium enhancement and late transmural LGE. Speckled myocardium is again an MCQ. Biventricular hypertrophy, thickening of interventricular septum, and biatrial enlargement. And the drug is tafamidis, which they answered correctly. 80 milligram daily oral drug for ATTR related cardiomyopathy. So I think team C, they get full 10 marks. Well done, a great answer. So next question will go to team D. Team D, are you ready? Okay, it is a single slide. I'll show you the question and read it for you side by side as well. 45-year-old male, recently diagnosed diabetes mellitus, presents with history of painful right leg swelling extending till the knee. Also gives history of weight loss and depression for 4 months. Chronic diarrhea, skin lesions for 4 months. On evaluation, DOTA TAT scan was done and reveals this. What is the skin lesion and what is the most likely diagnosis? There is some skin lesion shown to you, and there is some MRI, there is some CT scan and a PET scan shown to you, which is DOTA TAT, and the answer is skin lesion and diagnosis is required for the answer. Team D. Yes, Team D, your answer.
So the skin lesion is necrolytic migratory erythema and the diagnosis is glucagonoma.
Absolutely correct. It is glucagonoma and it is the most common and neuroendocrine tumor associated with DVT. So that is why they had the leg swelling, and the skin lesion are necrolytic migratory erythema dermatitis, which was seen in the first image. Diarrhea, diabetes, DVT, depression were the other clues given in the case. They get full 10 marks, Team D. Very good. So now the next direct question will go to Team E. Team E, are you ready? Again, it will be multiple slides, so I will go one by one, then I'll tell you when to answer. Okay, Team E. First slide for you. 25-year-old man admitted with 2-day history of painful micturition, acroparesthesias, perioral numbness, 4-day history of diabetes, 4-day history of diarrhea, vomiting, abdominal pain, thermal allodynia. Alcohol consumption exaggerated the symptoms. He came back from Bahamas 5 days back, where he had stayed for 3 weeks. He is currently on loperamide, which he is taking since he was started with diarrhea. Usually drinks 22 units of alcohol per week. A smoker. What is your likely diagnosis? And there is a clue in the next slide. You want to see the next slide, or you want to read it more? Okay, we need to know the final answer. You want to read the first slide again?
Ciguatera toxin poisoning.
So they are saying absolutely correct, full 10 marks. It is ciguatera poisoning, thermoallodynia, perioral numbness, acroparesthesias, GI symptoms precede or accompanying CNS symptoms, and they are absolutely correct in everything they've answered. Full 10 marks, well done. So already I think Team E is now taking a lead almost every time they're answering it correctly. So now the chance for Team F. So I have 2 slides for you, Team F. So I'll show you both the slides, then you can take your answer. First slide for you, Team F, is this. 25-year-old male. Recurrent brownish greasy papules on chest, back, scalp, behind the ears for 5 years. Lesions worsen after sun exposure, heat and sweating. Occasional foul odor due to secondary infections. Family history is there. Mother has similar skin lesions. On examination, skin lesions are hyperkeratotic, crusted papules in the chest, scalp, nasolabial fold, V-shaped notching, white streak, white cobblestone in the oral mucosa. Have you gone through the first slide? Do you want to see the second slide? There is a clue in the second slide also, team EF. Team F, should I show you the next slide? Yes. Next slide is this. What is the diagnosis, histopathological finding, and the gene mutated? Even if you answer half, we will be looking at it. Don't worry. Okay, team F.
The Darier's disease.
Okay, correct. And what do you think is the histopath and the gene mutated?
Gene ATP2A2.
Correct. And any histopathological word you want to say? Anything you want to say?
Brick wall, sir. Dilapidated brick wall.
Okay, what I'll do is we will give it to you. The diagnosis is correct. It is Darier's disease. Histopathological answers that we were looking for were suprabasal acantholysis, disc keratotic cells, cop rounds and grains. Autosomal dominant is the inheritance, and gene you got it right, ATP2A2 gene, correct. So we give full 10 marks to team F. In the next 6 questions, we'll go anti-clockwise. We'll start at the F and then we go backwards so that it is fair for everyone. Again, there will be multiple slides. Team F, are you ready for your next question? Okay. So team F, I will show you the question now. Patient presented to emergency with sudden onset palpitations and dizziness. Pulse rate 180 per minute. Hemodynamically stable. ECG will come in the next slide. You have to diagnose and tell the treatment. Okay, done? This is the ECG. You have to diagnose and give the treatment. I'll go backwards. Palpitations, heart rate, ECG. They're saying torsades pointis and hyperkalemia, which is not correct. So no marks. Any other team wants to try it for academic reasons?
Fib with aberrancy.
Correct answer. So what we are looking at is atrial fibrillation with WPW syndrome, pre-excitation AF, fast, bizarre, irregular, differing heights and durations of QRS. And the treatment is, if the patient is hemodynamically unstable, procainamide. If unstable, DC cardioversion. That was the answer that we were looking for. So we don't give any marks to the team now. And now the next question is for team E. Okay, again, there will be 2 slides now. Team E, are you ready? Okay, so I'll show you the slides one by one and we'll take our time, don't worry. A 46-year-old man comes to emergency with 2-week history of diarrhea, nausea, abdominal pain, weakness. His weight loss of 8 kg in preceding 2 months and was sexually active. Lab studies have a serum creatinine level of 2.4. HIV is positive. Viral load is 114121 copies per ml. CD4 count is 2 cell per millimeter cube. Despite fluid resuscitation, renal function worsened and a renal biopsy was performed. Please take out the keywords from the first slide so that I can show you the next slide. Next slide, I will show you the renal biopsy. Okay. Okay, should I show you the next slide? Okay. What is the diagnosis and the treatment that you will give in this case? They are correct in their diagnosis and as well as the treatment. So the patient was HIV positive, the renal biopsy was shown to you, and the answer that we are looking for is cryptococcosis, liposomal, amphotericin B and flucytosine are the treatment. So we give full 10 marks to team E. Well done. So we go to the now team D. Team D, are you ready, team D? Okay. So let me see the question. So it is a slightly longish question, again multiple slides. So you tell me when you want me to shift this slide. See, team D, direct question for you now. Team D, 23-year-old male, 2-month history of nausea, abdominal pain, yellowish discoloration of entire body, high-grade fever, chills, worsening pruritus, febrile with bilateral scleral icterus, epigastric tenderness, no guarding, no organomegaly. ALP is 818, AST to ALT is 144 by 146. Total bilirubin to direct bilirubin 6.2 by 3.9, INR 2.23. Viral Hep panel and ANA are negative. CECT, TAP, hilar and retroperitoneal lymphadenopathy. Biopsy from the nodes suggestive of Hodgkin's lymphoma. Okay, team D. Okay, have you noted it down? Okay. So next slide will be a liver biopsy image, and you have to give the final diagnosis. You have to give the final diagnosis. The clue is already there in the question itself.
So the diagnosis is vanishing bile duct syndrome.
Absolutely correct. So due to associated with Hodgkin's lymphoma, the patient is having vanishing bile duct syndrome, which is shown in the image in the liver biopsy. Full 10 marks to the team D. Full 10 marks. Well done. Okay. So the next direct clinical case, which will be a single slide, will be for team C. Team C, are you ready? Team C. Yes. 34-year-old male, chronic IV drug abuser with history of IV cocaine use, came with fever, arthralgia, night sweats, weight loss. Also has nasal septum perforation. 2 days back, he has skin lesions on his body. On evaluation, C Anka, P Anka are positive. What is the diagnosis given the drug exposure history? Yes, team C. What is the final diagnosis that you're saying? What is the diagnosis? Okay, we'll tell you the answer. Let's see if we can give it to you or not, but I don't think we will be able to give you. The correct answer that we have is thrombotic vasculopathy has happened. Vasculitis is due to levamisole contaminated with cocaine. Cocaine adulterated with levamisole leads to septal perforation. Thrombotic vasculopathy, trigger vasculitis, can cause CP Anka positive. Levamisole in antihelminthic drug can cause vasculitis, agranulocytosis. So we'll ask all the other teams, can we give it to them or no? No, I think nobody is agreeing. Okay. So we cannot give it to you. I think you were not close to the answer. Okay. So next direct question is for team B.
Team B, are you ready?
Team B, yes. It's a single slide. It will not take time. So I'll show you the question directly. 6-year-old male child, learning disability, regression of language skills, loss of postural tone whenever he laughs. On examination, weight of 18 kg, vertical gaze palsy, frank ataxia, genetic testing negative, Philippine stain on skin, cultured fibroblast was positive. You need to give us a diagnosis and a new FDA drug, approved drug for it. Unfortunately, it is not correct. Any other team wants to try it for academic reasons? So what you see here is vertical gaze palsy, ataxia, and the patient loses postural tone when he laughs. That is gelastic cataplexy. This is the triad. Can you now connect the dots into our diagnosis for no marks? But so the diagnosis that we have is Niemann-Pick disease type C. And even if the genetic testing is negative, Philippine staining on the fibroblast helps us to diagnose Niemann-Pick disease. And the drug that we were looking for was levoacetyleucine and erimocomol. So that was the answer to the question. It was a good quality question, but unfortunately, no team got it right. So final question of this round is going to have 2 slides. Okay, 2 slides for team A. Team A, are you ready? Okay. 51-year-old woman, history of ALL, presented with cough, pleuritic pain on the left side, no fever. She has undergone bone marrow transplantation 3 months back. GVHD had developed, for which treated with cyclosporin and high dose glucocorticoids. LPCB mount of bronchoalveolar lavage sample was done. So there's another image and you have to look at the sign and the diagnosis. Should I show you the next image? Give the diagnosis and the classic radiological sign visible in this image. Yes, team A. What is the diagnosis and what is the sign visible here? There is something visible in the slide and the CT scan, which is okay. I'm going back to the question slide. You want to see it again? Patient has bone marrow transplant, treated with cyclosporins, glucocorticoids. Bronchoalveolar lavage is shown to you. Okay. The time is up now. Final answer. Absolutely correct. We are looking at mucormycosis and the sign is reverse hello or atoll sign, where you see a central ground glass with a ring of consultation surrounding it. Patient was on steroids, which was the clue in the question. Well done. They get full 10 marks and they got it on the edge actually. Okay. So I'll request now to see the score at the midpoint of the quiz. We are done with the first 3 rounds. Team A is right now at 52.5 marks. Well done. Give them a round of applause. Team B is at 30 points. 30 points. Team C is at 55. Team D is at 45. Team E is at 70. Well done, they are leading the table. Team F is at 20. So we are locking the scores now for the first 3 rounds. There will be no change in the scores after this. However, we can call it bird's sign also, which is actually a better name also. Yes, correct. Okay, so the next round is going to be the defining round for this quiz. Okay, this is called as buzzer round. In this round, we'll have 25 questions. Total time to answer will be 5 seconds from passing the buzzer. Correct answer will give you plus 10. Incorrect answer will give you minus 5. There will be no pass and the decision of the quiz master will be final. Are you ready? Plus 10 minus 5. No, there will be no pass. मतलब उसको नहीं बताया minus 5 हो गया बस, that's all. Plus 10 minus 5 ऐसा, ठीक है? Ready? Everyone ready? On your marks, fingers on the buzzer, and the first image is here. Connect and diagnose. And team E is the one which has pressed the buzzer first. Team E, what is the answer? They say Fabry's disease plus 10 for team E. Plus 10, very good. Okay, ready? Ready now? Fingers on the buzzer. Okay, second question for you will be this. Name the sign elicited. Team D, Team D, Team D. They are saying Nicola Denny Branham sign, which is correct. When an artery is proximal to the fistula is compressed, blood is no longer shunted and the peripheral vascular resistance is increased suddenly, causing relative hypertension within 2 heartbeats. Very good. The team D gets plus 10 marks. Okay. Okay. Next question will have 2 parts to it. So press the buzzer when you know both the parts. Are you ready now? 1, 2, 3, go. Name the staging and where it is used. And the buzzer has been pressed first by the team E. Perfectly correct answer. It is Cotton Mayer staging for subglottic stenosis plus 10 marks, team E. Very good. Okay. Now in the next question, there will be 2 things to be identified. 2 things to be identified. Are you ready now or there's an error? Okay. Just everybody, once they are ready, just let me know. Ready? Okay. In the next question, everybody, are you able to see? Ready? You have to identify the hidden box A and B. And it is a tetrahydrobioterin pathway visible in the image. What is A and what is B? Anybody has pressed the buzzer? No. So in this image, the A was GTP cyclohydrolase and B is sapieterin reductase, which is used as an enzyme replacement therapy in phenylketonuria. And the A was GTP cyclohydrolase, Segawa disease, DOPA responsive dystonia. Okay. So in the next question, you will have to identify multiple images. Okay. So I'll just, there will be 3 images. You have to identify all 3 to press the buzzer. Okay. Ready? 1, 2, 3, go. Identify the following trichogram images. Team D is going to answer now. Team D, what is your answer? Perfect. So first is trichoherexis nodosa. Second is trichoherexis invaginata. Third is pili torti. Perfect. They got it. All of them correct. The third was Menke-Kinke hair disease. The second was Netherton syndrome. And the first one was arginosuccinate lyase deficiency. So team D gets 10 marks. In the next question, I'll show you a picture and you just give the diagnosis. Okay. Ready? 1, 2, 3, go. 69-year-old male underwent cataract surgery, vitrectomy, 3 years, has following finding after 3 years. This is the image. Okay. So team E. E. Yes, team E. They are saying it is inverted hypopyon, which is absolutely correct. It is inverted hypopyon or emulsification of silicon oil in the anterior chamber. Density of silicon oil is lower than that of aqueous humor, leading to the appearance. Team E gets plus 10 marks. Well done. Okay. So in the next image, I will show you a question and you will have to tell me diagnosis as well as the next investigation. Ready? Okay. Connect the pictures. What is the diagnosis and what will be the next investigation to be ordered? Team C will be the one which will be answering. I think we'll have to take -5 now. That is not the answer we have. -5. Anyone else wants to do an academic answer? Yes, Teamy.
Neuroacanthocytosis.
So the answer that we have is there is hypodensity in the lentiform nucleus due to uremia, and the microscopy shows burst cells which are echinocytes. So we were thinking of uremic encephalopathy, and the next investigation was renal function tests. So only team C gets -5. Team C gets -5. In the next, there will be multiple images. You just need to tell me the final diagnosis. Ready? And the image is here. Connect the dots. What is the diagnosis? Team E, what is your answer? Team E.
Pseudoxanthoma elasticum.
Perfect. It is Pseudoxanthoma elasticum. You could see the angoid streak, chicken plug-like elastic skin, yellowish papules and cobblestone papules in the neck, and Verhoff van Gosen staining shows elastic fibers. In the next image, you just need to name the drug which is indicated by the images. Ready? 1, 2, 3, go. Identify the drug. Team C, yes. Team C says warfarin, which is absolutely correct, plus 10 marks. It is Wisconsin Alumni Research Institute and Cormerin, which is the full form of warfarin. Carl Paul Link was the man who discovered warfarin. And we could also see the sweet clover leaf plant, which initially kettles who feed this plant started bleeding. That was the kettle eating the plant was shown here. Used as a rat poison, so we showed you the rat poison, and there's a logo for the Wisconsin Institute shown in the image. Okay. In the next question, you will have to name the antibiotic. Okay, I'll show you something and you have to name the antibiotic. Ready? Name the newer antibiotic which acts through mechanism shown below, acting against MDR, gram-negative bacteria, Pseudomonas, and complicated UTI. Team C wants to answer. Absolutely correct. It is cefiderocol, which is a novel citrophore cephalosporin against carbapenem resistant JNP. So team C gets plus 10 marks. Team C is now disconnected again, so we will give them some time to get back. Ready? Okay. Ready? Everyone ready? Okay. In the next image, you need to name the radiological scoring system and the treatment of this disease. Team A, yes. Anyone wants to ban on, or should we give them the marks, or we should not give them? Okay, so 0 we should give, or minus? So it is adrenoleukodystrophy, and the treatment is Lorenzo's oil, which is correct. What is the scoring system? Team, anybody wants to answer just for the purpose of answering? The scoring system is Lois scoring system, and the Lorenzo oil is the treatment that we discussed. Well done. So in the next image, I will show you. As a team A here will get 0 is okay. We are not cutting the marks. We are not giving the marks. Okay. Everybody is okay with it. We cut off that question only. Okay. In the next question, there are multiple answers, so be careful and when you press the buzzer. Okay. Identify and name the fetal scalp autopsy method A and B. So no one has answers. So the A is a butterfly shaped 2 flaps Benkes method, and B is 4 flaps bar method. Fetal autopsy methods for scalp. Next is an interesting question. Again, there will be 2 answers. You will have to name them and name their content also. So be very sure when you're pressing the buzzer. Okay. Identify the foramen A and B in the sphenoid and their content. Team E wants to give an answer. Team E. Okay. So what are you saying? A is foramen of rotundum. And what is passing through it?
Maxillary, V2 division.
Okay. And what about B? What is B?
Widens canal.
What is passing through it?
Nerve to the Widens canal.
Okay. Absolutely correct. So A. Okay, so again the same controversy arises. We give them the same treatment. We'll give them 0 marks, not cut, not take. Okay. So next time you don't change the answer. So whenever you're speaking, so anybody who's speaking would be considered final. So sometimes we get confused. Are you discussing amongst yourself or are you answering? So we'll consider your answer as the final. Ready? So no marks for anyone here. and it was foramen rotundum and Vidian canal. Those were the images shown to you. In the next, again, there are two answers, and I think we need both the answers to give you the marks, okay? Otherwise, we'll deduct the marks this time, so we'll not be soft now. 2 times we have been soft. Now you have to. What are the 2 monoclonal antibodies approved for the disease shown below? Team C, yes. And what is the disease? Perfect. It is anthrax, boxcar appearance, Medusa head appearance. They didn't change. I think they were speaking it of. I think they gave it. So correct answer is Rexibasumab and Obeliteximab. Okay, we give them 10 marks. Perfect. No need to get heated here. It is okay. Plus 10 marks, beta. Very good. Okay. In the next question, okay, it is just about identification. Okay, it is just about identification. Ready? On your marks. Identify. Anyone? It's very easy. Team B. Perfect. These are the Lechenberg flowers, filigree burns, high voltage injury due to lightning. Team B gets plus 10 marks. Very good. So in the next question, there is you have to see the cover page. Okay, so keep in mind. Okay, what is this image mentioned in the cover page of Gray's Anatomy? There is some image shown in this cover page. You have to tell that image. Which team? Team D -5. Okay, so anybody wants to just give a try? This is diffusion tensor imaging, tractographic imaging. Yes, but they are showing the peri-sylvian language pathway on the cover page of Gray's. This Dr. Henry Gray was visible there. So it's an interesting thing what all they put on the covers, and we never bother actually. So next is a very easy question. So you will just have to connect the dots. So it is very easy to be on the buzzers. Okay, ready? Connect the dots and give me the diagnosis. Yes, Team E. Team E. Ciliopathy. -5. -5. Team E -5. Okay. So anybody wants to give it a try based on the MRI that is visible here? Joberts. So the correct answer is Joberts. We had facial dysmorphism, orofacial digital features of Joberts, and you saw the typical appearance on the MRI of the molar tooth appearance. So in the next question, it is going to be 2 answers again. So you have to name both of them to get an answer. If you say incomplete, we'll deduct marks. Okay, ready? X is a mineral which is bound to mineral glutamine synthesis in astrocytes of the brain. Reverse transcriptase of HIV enzyme contains this, implicated in Parkinson's. X is cofactor of Y, which deficiency leads to hyperammonia, tetraparesis. Find X and Y. Team D, yes. Perfect. X is manganese and Y is arginase is absolutely correct. Well done. Team D, 10 marks. Team D, 10 marks. Okay. Now again there will be 2 answers in the next slide. Ready? Name the drugs A and B. Team E, yes. So it is incorrect and we have to take -5. Everybody is happy. So team D was, which was answering? E was answering, so -5. So A is correct. It is bempedoic acid, but the B was inclisiran. So this is what was visible in the image, and I think some of you got it right, but they could not press the buzzer at the time. In the next, you just need to give the diagnosis. So it is a simple one. Be on the buzzers right. Are you ready? From the platelet agrimetry shown, what is your diagnosis? Team A, yes. Perfect. They're saying Glanzmann thrombocythemia, which is correct. A team gets plus 10 marks. Very good. Plus 10. A. In the next, you have to identify. I think you have to identify the scientist. Let's see if you can connect and identify. Connect and identify. Team A. Perfect. Dr. Samuel Rabar, Iranian scientist who discovered HbA1c, gives glucose control over the last 3 months. Blue circle is the symbol of diabetes. November 14 is the World Diabetes Day. Team A gets plus 10. Okay. Next is easy. So be on your marks. Identify the histology shown to you. Okay, the time is up. This is the normal histology of tonsil. You could see the tonsillar crypts, stratified squamous, non-keratinized epithelium, lymphocytes arranged in follicles, germinal, central and mental layer was visible. Okay, let's see the next question, and I think we just need to name the drug, and if you give the mechanism is also required. Okay, both of them are required. Okay, ready? Name the new FDA approved MAB in June 2025 subcutaneous monthly injection for HAE and mechanism of action. This is too recent for them, I think. June 2025 approval. Team D wants to give it a shot. Perfect. Team D gets it right. It is garadacimab, monoclonal antibody targeting. Team D, targeting factor 12, used in hereditary angioedema, monthly SC injection. Okay, in the next question, we have to do some calculation. So we will need the numerical answer. So keep your pens ready and your buzzers ready as well. Ready? In a patient with Wilson's disease, calculate the serum free copper level if the total serum copper is 48, serum ceruloplasmin is 6. What is the free copper level in this question? Team B, yes. 3, 6, minus 5. Okay. Anybody else wants to give it academic try? So the formula is that you multiply the ceruloplasmin levels with 3 and 48 minus 6 into 3 is 30 milligram per deciliter. So anything more than 25 is suggestive of Wilson's disease. And now we are coming to the final question in this round, and you have to name the finding which is visible here. Okay, ready? A PLHA patient presented with these abdominal skin findings. What are these findings? Team B wants to give an answer. We need to know the finding. Anything you want to say? There's something we have very specific written here. Okay, so anybody else wants to give it a shot? So the answer that we have is periumbilical thumbprint parasitic purpura. So that was the answer. These are the purpura that is periumbilical thumbprint parasitic purpura. Thumbprint purpura is the advanced strongyloides infections. Strongyloides hyperinfection in PLHA, rapidly form larvae of strongyloides mimics vasculitis. Huh? -5 for team B. -5 for team B. Yes, good for reminding. Okay, so this brings us to the end of this round of rapid fire. And I think a lot of scores must have moved around. We should take a look at the scores before we move on to the next round. The next round will be very interesting, where we will look at recent advances. Recent advances will be there. Okay. 2 more rounds to go after this. So recent advances and the rapid fire will be the next 2 rounds. And now I have the score at the end of the 4 rounds. Team A is at 72.5 marks. Well done. Give them a big hand. Team B from West Zone is at 30 marks. Give them a big hand. Team C is at 80. Team D is again as 80. Team E is narrowly leading at 100. Team F 20. So at the end of this round, I think Team E is leading with 100. C and D are closely following at 80. A is at 72.5. The quiz is still open. The team which will win, I just wanted to remind you to encourage you. The winning team will get 50,000 rupees, 25,000 for the runner-ups, 25,000. And so there is a cash prize to be won. So I would encourage you to encourage each other. Think about what all you can do with the money. And we go on to the final round of recent advances.
Right, so we are going to do the round on recent advances. So there'll be a total of 12 questions. Each team will get 2 questions. We'll start from team A to F in the first round and then backwards from F to A. For correct answer, you'll get +10. There is no negative marking. There's no pass as well. 45 seconds for each question. Yes? Are the rules clear for everyone? Okay. So this is for team A. Team A, get set, go. Identify X and Y. X is a recently described disease manifestation in females that includes multiple paraganglia or pheochromocytomas and somatostatinomas, both neuroendocrine tumors, and secondary polycythemias associated with high APO. Co-occurrences are usually seen in patients carrying hereditary syndromes like MEN, NF1, and VHL. Identify the syndrome X and the new drug Y approved for it, which acts on HIF2 alpha. You have 45 seconds.
So by the time they're thinking, the team which will win will get 50,000, the second will get 25,000, and then third will get 15,000. So there is a prize for third also. So be on your toes. So time is up. Any answers, team A?
Okay, and okay, but that's incorrect. So that's right. Very nice. Yes. So team B has answered correctly. The X is Pazak-Zuhang syndrome, and the drug is belzutifan. Yes, it is HIF2 inhibitor. Okay. Well done, team B. Team B, it is a question for you now. So there will be a picture. Identify the logo and mention the components of the program. Identify the logo and tell us the components of the program. Time up, team B. Are you giving us an answer? No, that's incorrect. But yes, team E wants to answer. That's right. Do you know the components as well? Okay, so yes, this is the Muskan program. It is aimed at reduction in preventable mortality and morbidity among children under 12. It ensures provision of quality child-friendly services and adherence to these standard treatment guidelines. But yes, well done. No marks to team E, but well done. Team B, better luck next time. Okay, team C, are you ready for the question? There is an image for you, and you have to connect and identify the new drug. Connect and identify the new drug.
Ma'am, so it's a plexiform neurofibroma for NF1 and the drug is selumetinib.
That's incorrect. The drug is incorrect. It is... Yes, that's right. Very good. So plexiform neurofibroma and mirateminib is the drug. That's right. And you were close, but the drug was incorrect.
For half because 2 parts.
Identify the drug, tha. Connect and drug. So no marks. Okay, team D, are you ready? So your question is here. According to ACTRIMS 2024, what are the recent changes made in the multiple sclerosis diagnostic criteria? Mention one extra site proposed to be added, the new biomarker proposed to be added other than the CSF OCB, and 2 new imaging markers proposed to be added.
Do you want to give the answer? Okay. So we are not giving you any marks here. See, the new site which have been added is optic nerve, which is the 5th affected area which can affect MS. The new biomarker is kappa-free light chain, and the radiological signs are central vein sign and paramagnetic rim lesions. And dissemination in space can now be satisfied with lesions in 4 or 5 different topologies, even without dissemination in time. So optic nerve is the answer, kappa-free light chain is the answer, central vein sign, paramagnetic rim lesions, and dissemination in space, even without dissemination in time. That is the key changes. Okay. Question for the team E. Are you ready?
Team E, question for you on the screen now. Identify the new treatment modality for Peyronie's disease.
Nesbitt's technique.
Sorry?
Ziaflex is used, which has collagenase of...
Yes, they are right. Ziaflex. So intralesional injection of collagenase Clostridium histolyticum called as Ziaflex. Very good. So team E gets plus 10 marks. Well done, team E. Team F, are you ready, bachas? Identify the liver transplant method. Identify the liver transplant method. Correct. That's right. Domino's liver transplant. Liver from a donor who has FAP is transplanted to a recipient who needs the liver. Plus 10 for team F. Okay, team F, we are going to go anti-clockwise. So there's another question coming your way. Are you ready? So your next question is on the screen now. Identify the plot and mention its uses. Okay. And the uses? So there were 2 parts to the question. Identify and mention its uses. Yes, can you give us any one use?
Gene sequencing.
Okay, we will give that to you. That's right. It is the Circos plot. So circular visualization tool that effectively displays relationships and patterns in complex data, particularly in genomics or bioinformatics. And yes, gene comparison is one of the methods, microbiome and epigenetics as well. Well done, Team F. So plus 10 again for Team F. Team E, are you ready? Okay. Your question is on the screen now. From July 1, 2024, Bharatiya Nyaya Sanhita BNS has replaced the IPC. So change the following IPC sections into BNS. Yes, again, important. No. But you've given us 4 out of 3 correct. 3 out of 4 correct. So definition of grievous is 116. Definition of rape is 63. Okay. Dowry death is 80. And crime done by insane is 22. I think I'm going to give it to you. So 3 out of 4 we'll give plus 10. Yes, that's a fair thing. Okay. Team C, are you ready for your questions? D, sorry. Yes, Team D, are you ready? Okay. What is the name of world's first FDA approved wrist-worn wearable watch for detection of convulsive seizures? No, that's incorrect, Team D. Anyone else wants to give an answer? Okay, this is interesting. So this is Embrace 2 for detection of possible convulsive seizure alerts for the caregivers. Produced by Empatica company. First FDA approved wearable device for detecting epilepsy, right? So Embrace 2. Okay. Yay. Okay, Team C, are you ready? Okay. On your screen now, identify the new kit 8 added to the STD treatment kits. Come on, you should know this one. And mention the targeted syndrome and the components of the kit. STD kits are very, very important.
Brown kit.
Yes. That is already given to you. You have
for
to...
anorectal discharge.
Okay.
Cefixime, metronidazole and doxycycline.
Most of it was right though. So yes, kit 8 is for anorectal discharge. That's right. Cefixime is there. That is also correct. 800 milligram single dose. Doxy is there. 100 milligram twice a day for 7 days. But metro isme nahi hai yaar, wo yellow kit mein hai na? So I think we should give some marks. Oh, they're so nice. ठीक है, मैं तो पूरे देने वाली थी, but okay. So let's give them plus 5 marks to Team C. Acha, do you all know that now Cefixime dose has been changed? So earlier it was 400. Now it is 800 single dose, right? Okay. Team B, are you ready? So I'll take a minute to read and you'll also have time. Chalo, on your screen now. Name the sign and which condition it is seen. 69-year-old female, acute lower limb weakness and urinary retention, progressing to quadriparesis and dyspnea within days. There's history of fever, arthralgia, myalgia for 6 days before neurological symptoms. CNS में severe quadriparesis है, extensa plantar responses है, cervical sensory level. MRI has shown you the T2 hyper signal longitudinal extensors involving peripheral zone and spares the central gray matter. Name the sign and which condition it is.
Time up.
Is it neurosarcoidosis trident sign?
No. Okay, anybody else wants to give it a shot? So it's a new sign described for chikungunya myelopathy. It is called as glass eel sign seen in chikungunya myelopathy. Involves the peripheral zone, spares the central zone of the spinal cord. And final question of this round for Team A.
Okay, Team A, on your screen now, identify the classification. Identify the classification. Just the name of the classification. Okay, I'm afraid that is incorrect. So this is Matthews-Nahai classification for musculocutaneous flap reconstruction. But well tried, Team A.
I think that brings us to the end of this fifth round, and now only one round is left. So let us see the scores before we go on with the further rounds. So at the end of this round, Team A is at 72.5, Team B is at 30, Team C is at 85, Team D is at 80, Team E is leading now with 120, Team F is at 40. Now the final round that we have is going to be the rapid fire round. In this round, what we'll do is, and I'll take your suggestions on also on it. Or you want us to read the question one by one and then you answer, or you want to, okay. So we can display all, give you 60 seconds, you write, and then we'll tell you the correct answer. We'll take your sheet and we'll check it and then take it. Is that okay? Okay, you can speak it out also, and we'll keep saying right, wrong, okay, like then, okay. So I'll just tell you the mark. Total 6 set of questions will be there. Each set will have 10 questions. Time allotted to you will be 60 seconds. 10 points for correct, no negative marking. If you skip, but that is not applicable here because we are going to show you all of the questions and our decision will be final. Okay, ready? Kanika? Kanika, your time. 60 seconds, huh?
Team A, are you ready?
Team A. Yeah. You can stand also, come closer also. We'll just keep saying right, wrong, like that. So we have to count, okay? Okay, and everybody else can keep a track also so that you can keep a track of the final winners. Team A, your set of questions is on the screen now.
Second is beta ketone acid dehydrogenase.
Seven is seen in polymer bodies is seen in all box.
Which one is that?
The four.
Sixth is 29 September.
4 is correct. 6th is correct.
Fracture is basically a vertebral fracture.
Which one is that?
7, 8.
8.
Incomplete answer is there. You have to give better answer.
Vertebral fracture in XIV. Covalent glutenase is hidden hemorrhage present in the uterus. Addition of plasminomegalia. Abrasive plasminomegalia.
Okay, give it.
Correct. 7 is also correct.
5 is P2C.
9th is navicular. Sorry, 9th is Kienbock disease.
Incorrect. Okay, so we'll tell you the correct answers and then we'll have a discussion on the what you all answered correctly or not. We'll see. So I think 3 or 4 maybe. Let's see. So the first was Simpson's fascia is degenerative tendon of which muscle? Answer was cleanliness minimus. You did not answer this question. Enzyme deficient in maple syrup urine disease is branch chain acid dehydrogenase. I think you answered something else. Is that same?
That's a different enzyme, right?
Is it same or no? Okay. So what they said is right or not right? Not right. Okay, so we were not giving it to you. Mannitol, egg yolk, phenol, red polymyxin agar is for which organism? The answer was Bacillus cereus. You did not give this answer. Bollinger bodies are found in fowlpox. Correct. You answered it correctly. So 4 is your correct. 1 is correct. Okay. Name the new FDA approved tissue factor pathway inhibitor which is used in prophylaxis of hemophilia A and B is Conizumab. I think you answered it wrong. When is World Heart Day? September 29. You were right. You answered it correctly. Covillary uterus is seen in uteroplacental apoplexy, concealed abruption, which is answered correctly by you. Chance fracture is horizontal splitting of the body, pedicle, and the posterior element of the vertebra in the thoracolumbar region in seat belt flexion distraction injury. Very partly you had answered. Actually, you said vertebral fracture, but like very inspecific, so we may not be able to give it to you. Osteochondritis of the capitulum is Panner's disease. You did not answer it correct. Book test is used for testing which muscle? Adductor pollicis. You did not answer this. So I think you answered 3. 3 correct, 30 marks. Plus 30 marks for team A. Okay. Now is it time for team B to start looking at their set of 10 questions. I will display it and then we'll put on the timer. Are you all ready? Team B. Which question? Fourth.
Which one?
3 is correct, 4 is correct. Okay, so we'll evaluate with you together. So see which all you answered correctly, which all you were wrong. So when we go back now at the questions, which nerve is involved in chiralgia paresthetica? And it is superficial branch of radial nerve. I think you said radial nerve and superficial branch. I think it is correct. 1 is correct. Enzyme deficient in homocystinuria, cystathione beta synthase. You answer correctly. Cephosizin, cycloserine, fructose agar culture media for Clostridium difficile. I think you answered it correctly. Gupta bodies or dust bunnies are seen in actinomyces. You answered it correctly. Interleukin 3 monoclonal antibody used in moderate to severe atopic dermatitis is lebrikizumab. I think you did not answer it. World Brain Day is July 22. You did not answer. Spalding sign is seen in intrauterine fetal death. I think you were right. Tilloch's fracture is anterolateral distal tibial epiphysis fracture. I think you did not answer this. You said talus. I think you did not say tibia. And osteochondritis of calcaneum is called a Sever's disease. I think you did not answer. Card test is for which muscle? It is palmar interossei. Palmar interossei. I think we can give it to you. So total
6 correct.
6 correct. 60 plus 60 marks.
Plus 60 for team B.
Very good. So now we will invite the team C to come in front for their set of questions. I would also request when you are answering, just say the number of the question also. Question 1, like that you answer, so it becomes easy for us to track. Are you ready? Time is up. Okay. So let's review your answers and see the exact answers that you got. The connection between ulnar and motor branch of median nerve is called a Riche-Kenyu anastomosis. I think you did not answer it. Incorrect. DNA repair mechanism is deficient or abnormal in De Santis-Cacchione syndrome is nucleotide excision repair. Incorrect. Wilson-Blair bismuth sulfite medium is for salmonella. I think you answered it correctly. So 3 is correct. Schiller dual bodies are seen in yolk sac tumor. Correct. PPAR delta agonist is used for treat primary biliary cirrhosis is seladelpar. But are they in this category? No. So incorrect. World Hand Washing Day, October 15. You got it correct. Robert sign is gas in the fetal heart in IUD is correct. Ronaldo sign is intra-articular fracture with the first metacarpal. You said fifth.
Yeah, they said
You said fifth. So incorrect. That is silly mistake. Osteochondritis of navicular is Kohler's. You said Kinbox, which is incorrect. Igawa test is for dorsal interossei. It is correct. You answered it correct. 5 correct, 50 marks.
Okay, well done.
Now we will invite team D for their direct set of questions. Are you ready now for this set of questions? And you can start answering. Okay. On your marks, get set, go. Time up. Okay. So we will just see the answers and we'll have a discussion now. Connection between median to ulnar nerve in the forearm is called as Martin-Gruber anastomosis. I think you answered it correctly. Enzyme deficient in galactosemia type 3 is UDP galactose 4 epimerase. You answered it correctly. Leventhal medium is for Haemophilus influenza. You were wrong. Michaelis Gutmann bodies are Malakoplapia. Correct. CXCR4 antagonist for Vim is Mavorixafor. You got it right. World Mental Health Day is October 10. You got it wrong. Osiander sign is pulsation in lateral vaginal fornix is correct. Clay-Chauvel fracture is avulsion of spinous process of C6-7. You did not answer. Kinbox disease is osteochondritis of Luned. You got it right. Pen test is abductor pollicis brevis. You got it wrong. Yes. Longest bola tha. So 6 correct. 6 correct plus 60 marks. Well done. So now we are about to come to the end of the quiz now with the team E. Okay. And you will see that most of the questions are similar difficulty level in each set so that nobody is complaining. Ready? Team E. So time is up now. So let's review your answers to get to the correct answers. The connection between ulnar and medial nerve in the forearm is called as Marinasi syndrome. I think you did not answer this. Enzyme deficient in Richner-Hannard syndrome is tyrosine aminotransferase. You get it correct. Barber, Stoner, Kelly, BSK medium is for Borrelia burgdorferi. You got it correct. Hamazaki, Weissenberg bodies are seen in sarcoidosis. You did not answer this. FDA approved drug which is endothelin A antagonist used to reduce proteinuria in IgA nephropathies, atrasentan. You did not answer. World Stroke Day is October 29. Chadwick sign is bluish discoloration of vaginal mucosa in early pregnancy. You answered it wrong. Schoffer's fractures is intra-articular fracture of radial styloid process. You answered it correct. Osteochondritis of tibial tuberosity is Osgood scattered, which answered it correct. Kilo-Nevin sign is for flexor digitorum profundus and flexor pollicis longus. You answered it correctly. So 5 correct for you. 5 correct plus 50 marks. So we now invite the final team for the final set of questions for this mega grey matter quiz finale. Are you all set now? Are you ready? Okay, let me show you your set of questions now. Okay, so let's review your answers. So the question was structures ending with pseudoganglion. Answer is nerve to teres minor, deep branch of lateral plantar nerve. You did not answer this question. Enzyme deficient in Hawkins urea is hydroxyphenyl pyruvate deoxygenase. You answered it wrong. EMJH medium is used for Leptospira interrogans. I think you answered it correctly. Henderson-Peterson bodies are found in Molluscum contagiosum. You answered it correctly. Name noradrenaline, new noradrenaline dopamine reuptake inhibitor used to inhibit awake and reduce daytime sleepiness in OSA narcolepsy. Sorelli-mefetol. You did not answer this. World Hepatitis Day is July 28. You did not answer. Piscac sign is asymmetric uterine enlargement in early pregnancy, which is correct. Isaac Lopresti fracture is radial head fracture, dislocation of distal radioulnar joint, intraosseous membrane injury. You were answering it correctly. Osteochondritis of ring epiphysis called as Schumann disease. You did not try it. Froment sign is which muscle substitutes with flexor pollicis? Flexor pollicis substitutes for adductor pollicis. You were right. So incorrect. So 4 correct plus 40 marks. 4 correct plus 40 marks. So that brings us to the end of all the rounds. So I hope you enjoyed the rounds. I'll ask my team to give me the final scores, and I'll ask Dr. Deepti to give a final message to all the participants before we break up for the lunch.
Right. I think very well done to all the participants. Coming this far is in itself a great achievement, and you're all super bright minds and you've done exceedingly well even today. I think more than that, we enjoyed the process of quizzing. So it was a pleasure to have all you here, and let's see who are the winners for today's quiz.
So I know your hearts are beating fast, and I know you're anxious, because it is not just about the cash prize, it is also about the prestige. Every year people who win the DAMS Grey Matter actually end up getting a top rank in one or the other exam. And actually many of them, they go on to become famous doctors. There is a lot of prestige to DAMS Grey Matter, and I'm happy that you all have lived up to the prestige with wonderful answering. You actually surprised us with many of the answers. We never thought you would answer so well, but we have never seen such a brilliant batch answering in the Grey Matter ever. So without wasting more time for you, I'll just go on to the team which is at the bottom of the table. So the team which has come 6th today, which is not getting any prize, but a lot of encouragement from us for participating, and you've done well. Don't lose heart. It is never about winning and losing. It is always about participating. So team F has score of 80. I would request everybody to encourage them with a round of applause. Team which has come at number 5. Again, don't look at numbers and don't let them define your self-worth. It is only about a game where you got set of questions. Some of them you knew, and many times you had answers to the set which other people had. This is how life is. So team B, you are at 90. 90 at number 5. Team which is at number 4 is team from East Zone, which has at 103. We'll encourage you with a round of applause and some goodie bags and some awards from our side, but you are not in the cash prize zone, unfortunately. But it is still commendable that you've reached so far. Now we come to the interesting ranks. The team which takes home 15,000 cash prize, and we'll talk about the DAMS courses as well, which you'll get, is, any guesses? Team C from St. GS Medical College and KM Hospital. The Central Zone team with Leeladhar Nabar, Chetavi Bhanushali, Pranay Sinha. I'd like you to stand up and give them a round of applause. They have scored 135. Well done. And I could already see pharma was one of their favorite subjects in their answers. And the team which has come as the first runner-up in the DAMS Grey Matter, team which has scored 140 marks, is team D from RML Hospital, New Delhi. Arya, Tarunim and Riya Gupta, well done. You have scored 140. Just 5 marks more than the previous team. Makes you the second prize winner in the DAMS Grey Matter. And you take home 25,000 rupees. We have put them as 100 rupee notes and we'll give you a bag. Don't worry. Okay, please be seated. And finally, we come to the point where we have to declare this is the 14th year in continuity where we have done DAMS Grey Matter. It has been running for last 14 years now. Probably to the best of my knowledge, it is the longest running medical quiz in the country, with the same name and the same quiz master going on for 14 years. It is huge actually. So, Same scorekeepers also for 14 years. So I'd like to invite Kanika, Rakesh, Mahinder, all our team members, everyone who is here. I'll ask even the cameraman to leave the camera and come in front. They have been keeping the score for 14 years now. I never remember. So more than a decade, they have kept the score for DAMS Grey Matter. They have seen each one of you. And even before you answer, they know the correct answers now. Okay. So next time they will be participating. So no guesses now for the team which has won. Any idea? Team E from North Zone. From Maulana Azad Medical College, Delhi. Tejas Sekhri, Utsav Batra, Mihir Rai. Heartiest congratulations. You win this quiz with a score of 170. Massively ahead of any other team. And you were the outliers in this quiz. We give you a cash prize of 50,000 rupees and a lot of prestige. And we are all very proud of your achievement. We would love to give you a round of applause. And I'm sure you will rock in your final exams as well.